I want to share something that happened this week with one of the members of my Hope coaching program. Her name is Sarah. She's 38. She's been trying to get pregnant for over 3 years. So she started when she was actually 35, right? She's eating healthy. She takes her supplements. She goes to acupuncture regularly. She's done her testing. She exercises almost daily, avoids exposure to environmental toxins, and has intercourse in the days that she's ovulating. She's living a healthy life and doing everything that she can, but she's not getting pregnant. She's been consistent, doing research like many of you, reading books, living a healthy life for the past 3 years, but she's not seeing results. She's not getting any younger either, and the only thing that's been told to her is that she's got unexplained infertility. That's her diagnosis. What this does is put so much pressure on her. She started losing hope because how many negative tests can someone have without starting to question everything that they're doing? This situation puts many of you in what I call the fertility hamster wheel, where you are eating the same diet, taking the same supplements, trying the same things in bed, and not only getting negative results, but you are losing hope. And we don't want that. If you, like her, feel like you are getting nowhere with what you are doing, you're not alone. In today's Hope video, I'm going to share with you the new approach that I shared with Sarah, so you can start implementing some of the same strategies that she did into your daily life. Before we get started with today's episode though, I did create this free guide called the 7 Steps to Empower Fertility that you can download and use to get started creating your own fertility plan. That's right. I'm going to leave the link in the description below to make it easy for you to find. So I've got 3 main points that I shared with Sarah that I want to share with all of you. And each one is important in their own right. But I'm starting with number 1. And number 1 is about doing more testing, more in-depth testing to get to the root cause. And many of you watching, don't change the video yet, okay, may have said, oh, I've heard Dr. Marc talk about this. Dr. Sklar has said before, oh, we've got to do testing and we've got to do more testing. But I want you to understand why, and I'm going to share that with you in just a moment. And I want to talk about some of that testing that I think you need to be doing. And I'm going to give you this example by reading a testimonial from one of the women that I'm supporting. We'll put it on the screen for you as well. It says, I'm so thankful that Dr. Sklar allowed me to know about the sperm QT. Dr. Sklar was really certain about me doing this test among 3 other tests, and I'm really thankful for that. With the test that Dr. Sklar suggested, we can now diagnose the issue. When I got the abnormal results, that was the big moment. This is the testament, and I'm so glad and appreciative that I did the test. I should have never done an IUI protocol. This was the real highlight, and it gives us a chance to improve. So this is important because there are lots of tests out there, but doing the right tests in the right order to give you the right information allows you to make the best choices and decisions on your fertility journey. She references that she shouldn't have done an IUI. Well, because of the results from the test that we did, we recognize that actually doing an IUI would not have been successful for her, or a very, very low success rate. So it changed her perspective on not only the outcome of the IUI, but how she should move forward. And this is true for all testing. We need to have that information so that we know which way to move forward. It's not always about doing the testing so that we know, oh, okay, I can make some changes and I can improve them. That is one part of it. But it also helps guide you to be more efficient in your process and make better choices with treatment when those options are presented to you. So one of those tests is called the sperm QT test that her husband did, not her. And this test is giving us a more detailed evaluation on the quality of the sperm and the genetics, the epigenetics of the sperm. And it allows us to understand if this couple will have success trying naturally with IUI or IVF. It doesn't mean those results can't be changed or improved. They can, but it also gives you an opportunity to recognize, well, in a limited time, what is the best path for me moving forward. So that was the first test that I recommended to her. The second test that I recommended to her is a vaginal microbiome test. And this one is not just to take a swab of the vaginal canal and the cervix. This one is also collecting the menstrual blood, and it's doing a test to understand How are the good bacteria in the area, in the uterus and in the cervix? Are there any infections? Are there any viruses or bacteria? Is there any yeast? Are there any dormant infections, viruses that we're not aware of that are there? This gives us a very comprehensive information about what's going on inside the uterus that might be impacting implantation and not allowing that to happen or causing an early miscarriage. So this is also valuable and important information in their situation, not just hers, in both of their situations. So we've talked about the sperm, doing some more detailed testing on the sperm. We've talked about doing some more detailed testing on the environment inside the uterus and at the cervix. And now we want to do some additional testing when it comes to blood work. What else is going on besides the foundational labs that I always talk about? Is there something deeper going on with blood clotting or immune function? Or maybe there's more issues going on in a different system that could be impacting your reproductive function, like your adrenal glands, your GI, your gut. These are all things that need to be looked at on a broader scale, meaning more of you need to be doing this. And this very detailed testing will give us very valuable information on how to proceed forward and in what order we need to address things. That's why this is so important for her, especially when you've been diagnosed with unexplained and you don't know what's going on, like Sarah has been, and she's been trying for so long. We need to dig deeper in her situation. The second thing that I had Sarah do was press the reset button. Well, what do I mean by pressing the reset button? What I mean is we need to sometimes, even though she had a healthy diet, even though many of you are probably eating a healthy diet or what you think is a healthy diet, it may not be the right diet for you, even though it's healthy, right? So by pressing the reset button and being able to start fresh, it allows you to see how you feel eating a slightly different way. If some of the foods you were eating were not making you feel good and you just weren't aware, by eliminating them, you are now aware that you feel better. So the first thing I ask everyone to do is a 2-week simple detox followed by an elimination diet. That 2-week detox is going to allow you to just kind of ease into the next phase of the process, which is the elimination diet. And from there, you get into a little stricter diet, right? So the easy detox is just cutting out all the processed foods. If it comes in a package, basically you can't eat it. You've got to eat all fresh food. You've got to know where it comes from. And the quality of the food is super important, meaning it's got to be all organic and good quality food and meats. Okay. Then from there, you're going to go into elimination diet and you're going to cut out. She did this, by the way. You're going to cut out all wheat and gluten, all sugar, all alcohol, all caffeine, all dairy, and all soy. All of that goes away. If there are other foods that you suspect that bother you, you're also going to cut those out as well. Some of you might say that, you don't do well with nightshades or beans or whatever it is. You'll cut those out. And then you're going to go without those for a month. That's 4 weeks. And then you're going to slowly bring those back in one at a time, not one food group, but one item at a time. And you're going to space those out by 3 to 4 days. So you're going to eat one thing. You're not going to introduce anything else for 4 days. You're going to see how you feel. Any symptoms that you have, it could be sneezing, it could be itching, it could be bloating, indigestion, fatigue, nausea, whatever, headaches, that's a sign that you shouldn't be eating that food and we got to cut it out. And so that's what Sarah did and that's what I want you to do. And it's going to be different for each one of us, right? Maybe you think avocados are great and healthy, and they are, by the way, but maybe when you cut it out, it's not the right thing for you. Maybe you're allergic to it and you don't feel good. So this is a little testimonial from someone who did the same thing. She says, "Hi, Dr. Marc and Lonika. So I'm done doing the detox diet and currently on the elimination diet. Starting my 2nd week and I got my period Friday. Yay. We're happy about that. It's been about 5 months since I've had a period, so I know the change in my diet has definitely helped. She went without for 5 months. Now she has one. I wanted to start my Dutch test cycle mapping, but I don't know what schedule to follow now that I got my period. So should I follow? So she's asking a follow-up question. But basically, she did the detox first, then the elimination diet, then she started her period, and she hadn't had it in 5 months. That is progress. Number 3, she needed a different approach. She needed to work with a new doctor. In her case, she chose me, the fertility expert, but regardless, oftentimes we really just need a new approach. Many of you aren't working with anybody or anyone of substance or anyone who's really supporting you. So if that is the case for you, then absolutely you need some guidance, because it's not just about, doing some additional tests and doing an elimination diet. You have to be able to interpret those tests and those results and come up with a solid plan. And you've got to know how to order some of these things, put these things in place, and then know how to adjust things in the future. So you do need some coaching and some guidance. I really think that's essential for everybody. But if you've been working with someone and you're not getting results, you're not seeing results that you want to see, don't just stick with them because they're nice or you like them or you're comfortable with them and you've been working with them for a long time. Those are all fine reasons to stay with somebody, but in the end, you need results. So how are you going to get them? If you continue to do the same thing over and over, you're not going to get those results. And so I really want to encourage you to start to work with somebody new, with a different approach and a different perspective. If you're in IVF and you've been with the same doctor for a long time, not getting results, maybe you need a new IVF doctor with a different approach. They have different protocols. If you've been doing IVF and it's not working, maybe you just need something different. Maybe you need a natural approach and you want to work with someone like myself. Whatever the case may be, is you need a different approach. And this little testimonial will help you recognize that. So she needed a different approach. She reached out for one and she got it. And this is what she says. She says, fertility win, proactive fertility. She's been really proactive about her care. She says, don't quit is the mantra, not for her, but for everybody. She's supporting all of the members in the program. And she says, 11 months ago, my AMH was at 0.21, 0.21. Today, the result is 0.665. It's tripled, okay? So excited, and I can't wait for Dr. Marc to have our plan to even improve this number more. Thank you, Hope Fertility Program, for the hope. Thank you, Jesus. That's right. Not my words, her words, okay? And that's because she took a different approach. She worked with somebody new. That is what's possible. Improvement, not just in AMH, which is what she did, but improvement in everything, and the ultimate win, which is a positive pregnancy. If you're ready to get personalized fertility coaching, head to marksklar.com/discovery call to speak to a real human on my team so we can identify if having me as your fertility coach is the right next step for you on your fertility journey. I'm going to leave that link in the description below as well to make it easy for you to find. Until we speak, and I do want to speak with all of you, I'm going to leave you with this other video with the 9 things that you need to know when you are trying to conceive. And I'm going to leave that link down below as well. All right, everyone, until the next video, stay fertile.